Most of us grow up believing that modern medicine is a safety net, something that will always protect us, especially as we get older. Once we cross 65, hey, it feels natural to think that the more tests, surgeries, and procedures we undergo, the better chance we have at staying healthy and living longer. After all, isn't it safer to act early, fix problems before they grow, and leave no stone unturned when it comes to our health? But what if that belief isn't always true? What if some of the very procedures that seniors are told will protect them actually end up causing more harm than good? This idea may feel unsettling, even controversial, but it's a reality that more and more doctors are beginning to confront. Age changes the rules of medicine. The same surgery or treatment that once made sense in your 40s or 50s may carry very different risks and far fewer rewards in your 70s or 80s. The problem isn't that these medical procedures are useless. They can be life-saving in the right situations. The issue is that they're often applied too broadly to too many people without enough consideration of whether the benefits still outweigh the risks. For seniors, the line between helpful and harmful can become razor thin. Instead of delivering safety, unnecessary interventions may trigger complications, prolonged recovery, financial strain, and a reduced quality of life. This video is not about rejecting medicine or ignoring your doctor's advice. It's about balance. It's about understanding that healthcare after 65 is less about doing everything possible and more about doing what is truly necessary. By taking a closer look at some of the most common medical procedures offered to seniors, we can separate the ones that genuinely extend life and improve comfort from those that may end up stealing both. So stay with us as we explore 5 medical procedures that, for many people over 65, may do more harm than good. We'll look at why they persist, what risks they carry, and what smarter alternatives seniors can consider to protect both their health and their peace of mind. Procedure 1. Spinal surgeries for chronic back pain. Back pain is one of the most common complaints among older adults. By the time we reach our late 60s, most of us have lived through years of wear and tear on the spine. Arthritis, thinning discs, pinched nerves, these are realities of aging, and it's no surprise that chronic pain in the lower back becomes almost universal. The temptation for both patients and doctors is to fix the problem with surgery. Procedures like spinal fusion or laminectomy are often presented as a direct solution. If the spine is unstable, fuse it. If nerves are compressed, release them. On paper, it sounds simple, but the reality is far more complicated. Spinal surgeries in seniors carry risks that can outweigh the benefits. Unlike a straightforward hip or knee replacement, spine operations affect a delicate, complex network of nerves and muscles. Recovery is long, painful, and uncertain. For someone over 65, healing can be much slower, and complications, from infections to blood clots to lasting nerve damage, are significantly more common. Research shows that many seniors who undergo spinal surgery for chronic back pain don't actually experience lasting relief. In fact, some studies suggest that up to 40% of older patients continue to have pain even after surgery, and a significant number end up back in the hospital for additional procedures. This phenomenon even has a name: failed back surgery syndrome. Consider the story of Margaret, a 72-year-old retiree who suffered from persistent lower back pain after years of working on her feet as a nurse. When pain medications and physical therapy brought only temporary relief, her doctor recommended spinal fusion. The operation was grueling. The recovery took months, and while she initially felt some improvement, the pain slowly crept back. Within 2 years, she needed a second surgery to address complications from the first. Today, Margaret still lives with chronic pain. Only now she also deals with scar tissue and reduced mobility that she didn't have before surgery. Her story is not unusual. So why are these surgeries still so common? Part of the answer lies in how our healthcare system views back pain. Surgery often appears to be the most decisive solution, and doctors under pressure to provide relief may overestimate the benefits. At the same time, many patients believe that doing something is better than waiting, even if that something comes with serious risks. Add in financial incentives for hospitals and surgeons, and spinal surgeries remain one of the most frequently performed procedures among seniors, despite mixed outcomes. This doesn't mean that spine surgery is never appropriate. In cases of severe spinal instability, sudden loss of bladder or bowel control, or significant leg weakness, surgery can be life-saving. But for the vast majority of older adults with chronic back pain, less invasive strategies often prove more effective in the long run. Physical therapy, targeted exercise programs, anti-inflammatory medications, nerve block injections, and even mindfulness-based pain management techniques can reduce discomfort without the dangers of a major operation. The key takeaway here is that chronic pain doesn't always demand a scalpel. For seniors where every surgery carries higher risks, non-surgical management should almost always be the first line of defense. If a doctor suggests spinal fusion or another invasive back surgery, it's worth asking the hard questions. What are the chances this will actually fix my pain? What are the risks of complications? And are there safer, less invasive options I can try first? Back pain may be a fact of aging, but unnecessary surgery doesn't have to be. Sometimes preserving mobility and quality of life means avoiding the operating table altogether. Procedure 2. Knee arthroscopy for arthritis. As we age, arthritis becomes one of the most common reasons for pain and disability. The knees, which bear the weight of every step we take, are often the first joints to suffer. For people over 65, stiffness, swelling, and aching knees can make even simple activities, like climbing stairs or walking to the store, feel overwhelming. Understandably, many seniors search for quick solutions, and for decades, one procedure has been marketed as exactly that: knee arthroscopy. Arthroscopy is often described as a cleanup surgery. A surgeon makes a few small incisions, inserts a camera into the knee joint, and then uses tiny instruments to trim torn cartilage, smooth rough surfaces, or flush out debris. Because the cuts are small, it's sold as minimally invasive, with the promise of faster recovery and less pain than a full knee replacement. For patients desperate to regain mobility, it sounds like the perfect fix. But here's the uncomfortable truth. For arthritis, knee arthroscopy rarely works. Numerous high-quality studies, including randomized controlled trials, have consistently shown that the procedure provides little to no lasting benefit for older adults with osteoarthritis. In fact, some patients report no difference at all compared to those who simply followed a supervised exercise program or even underwent a placebo surgery. The issue lies in what arthritis actually is. Unlike a torn meniscus in a younger athlete, which can sometimes be cleaned up effectively, arthritis is a degenerative disease affecting the entire joint. Trimming cartilage doesn't stop the underlying process of joint breakdown, and flushing the knee joint doesn't prevent further damage. In other words, the surgery addresses the symptoms temporarily but doesn't solve the root cause. The risks, while lower than in major joint replacements, are not trivial, especially for seniors. Complications can include blood clots, infections, and reactions to anesthesia. And just as importantly, there's the cost of lost time. Recovery often means weeks of limited movement and physical therapy, with no guarantee that the pain will be improved in the end. Consider the story of Elaine, a 70-year-old grandmother who loved taking her grandchildren to the park. When arthritis pain in her knees made walking difficult, her doctor recommended arthroscopy, describing it as a quick way to clean out the joint. Elaine went through the surgery with high hopes, only to find her pain return within months. The disappointment left her not only frustrated but also less confident in seeking further care. Eventually, after working with a physical therapist and adopting a routine of swimming and low-impact exercise, Elaine found far greater improvement than surgery had ever offered. So, why is arthroscopy still performed so frequently on older adults? Part of the answer is psychological. Both patients and doctors often feel better when something concrete is being done, even if the science doesn't back it up. Another part is financial. In many healthcare systems, procedures are reimbursed at higher rates than conservative care, which creates incentives to recommend surgery over non-invasive alternatives. That doesn't mean all surgical interventions for the knee are pointless. In cases of advanced arthritis where daily function is severely impaired, a total knee replacement can provide genuine long-term relief. But for most seniors with mild to moderate arthritis, safer, evidence-based options exist. These include weight management to reduce pressure on joints, regular low-impact exercise like swimming or cycling to strengthen surrounding muscles, anti-inflammatory medications, and targeted physical therapy programs designed to improve mobility and reduce pain. The key takeaway is simple. When it comes to knee arthritis after 65, beware of procedures that promise a quick fix. Arthroscopy may sound appealing, but the evidence shows it rarely delivers real relief. The smarter approach is to focus on proven, non-surgical methods first, and reserve more invasive operations for the few situations where they truly make a lasting difference. Procedure 3. Stents for stable heart disease. Heart disease is one of the leading health concerns for people over 65. Chest pain, shortness of breath, and fatigue often lead to an immediate fear. A heart attack is around the corner. For decades, the medical response to these symptoms has been aggressive intervention, most commonly through the placement of coronary stents. A stent is a tiny wire mesh tube inserted into a narrowed artery to keep blood flowing freely. On the surface, it sounds like a lifesaver, and in certain situations, such as during or right after a heart attack, it absolutely is. But here's the surprising truth. For people with stable heart disease, meaning they have occasional chest pain but are not in the middle of an active heart attack, stents often do not provide the benefits patients expect. Large-scale studies, including the well-known COURAGE trial, have shown that stents in stable patients don't actually prevent heart attacks or extend life compared to medications and lifestyle changes alone. While they can reduce symptoms temporarily, the long-term outcomes are often the same as with non-invasive management. For seniors, this distinction matters even more. The procedure itself isn't without risks. Inserting a stent requires threading a catheter through blood vessels, usually from the groin or wrist all the way to the heart. Complications like bleeding, infection, kidney damage from the dye, or even a heart attack during the procedure are rare, but more likely in older adults whose bodies don't bounce back as easily. And while the stent may provide some symptom relief, it also commits patients to lifelong blood-thinning medications, which carry their own dangers, including a higher risk of serious bleeding. Consider the story of James, a 74-year-old retiree who experienced mild but persistent chest discomfort while gardening. Fearing the worst, he went to his doctor and was quickly referred for stent placement. The surgery went smoothly, and at first, James felt reassured. But 6 months later, he developed severe bleeding in his stomach, an unfortunate side effect of the blood thinners required after stent placement. Looking back, his doctors admitted that his condition might have been managed safely with medication and lifestyle changes alone. His outcome illustrates a critical point. Just because we can place a stent doesn't always mean we should. So why do stents remain such a common procedure in stable patients? Part of it is patient expectation. When people hear they have a blocked artery, the instinct is to want it fixed. Surgery feels more powerful than pills. For doctors and hospitals, there are also financial incentives. Procedures are reimbursed at higher rates than consultations or medication adjustments. Combined, these factors create an environment where stents are often offered more quickly than the science supports. None of this means stents are useless. In cases of an acute heart attack, they are life-saving and absolutely necessary. They can also be helpful in patients with severe, frequent chest pain that doesn't improve with other treatments. But for many seniors with stable heart disease, evidence strongly suggests that the best approach is medical therapy, using cholesterol-lowering drugs, blood pressure medications, and lifestyle modifications like diet and exercise. These options carry far fewer risks and, in the long run, offer the same protection against heart attacks as invasive procedures. The lesson here is that not all blocked arteries demand immediate surgical repair. For seniors, where every intervention comes with added risk, the smartest path is often the less invasive one. Asking your doctor, "Will this stent help me live longer or just relieve symptoms?" can make all the difference in choosing wisely. Procedure 4. PSA, screening for prostate cancer. For men over 65, few medical topics inspire as much anxiety as prostate cancer. It's one of the most commonly diagnosed cancers in older men, and because of that, routine screening has long been promoted as a way to catch it early. The most common tool is the PSA test, a simple blood test that measures levels of prostate-specific antigen, a protein produced by the prostate gland. Elevated PSA levels may suggest cancer, but they can also be caused by benign conditions like an enlarged prostate or even a recent infection. On the surface, the test seems harmless. A quick blood draw, no risks, and potentially life-saving information. What could go wrong? The problem isn't the test itself, but what often comes after. High PSA levels frequently trigger a cascade of follow-up procedures: biopsies, scans, surgeries, or radiation treatments. And here's where the trouble begins. The reality is that most prostate cancers grow so slowly that they never become life-threatening, especially in older men. Studies show that many men over 65 with prostate cancer will live the rest of their natural lives without the disease ever causing symptoms. Yet once a cancer is detected, the instinct for both patients and doctors is often to treat it aggressively. These treatments carry significant risks: incontinence, erectile dysfunction, bowel problems, and long recovery times. In some cases, the cure can cause far more suffering than the disease ever would have. Take the story of Harold, a 69-year-old who underwent routine PSA screening at his annual checkup. His levels came back elevated, leading to a biopsy that confirmed prostate cancer. Fearing the worst, Harold chose surgery. While the operation removed the cancer, he was left struggling with urinary incontinence and loss of sexual function, side effects that deeply affected his quality of life. Years later, his doctors admitted that his cancer likely would never have caused him harm, and monitoring might have been the safer choice. Harold's experience reflects what countless men go through: overtreatment driven more by fear than by evidence. So why does PSA screening remain so common? In part, it's because cancer is a uniquely terrifying word. Patients want certainty, and doctors want to act decisively. Screening also feels proactive. It reassures patients that they're doing something to protect themselves. But the truth is more nuanced. While PSA screening can help in certain high-risk cases, such as men with strong family histories or certain genetic markers, blanket testing for all men over 65 often creates more harm than good. Today, many medical organizations, including the U.S. Preventive Services Task Force, recommend against routine PSA screening for older men, or at least suggest making the decision carefully in consultation with a doctor. In many cases, a strategy called watchful waiting or active surveillance is far safer. Instead of immediate surgery or radiation, doctors monitor PSA levels and only intervene if the cancer shows signs of becoming aggressive. This approach avoids unnecessary complications while still keeping patients safe. The key takeaway is this: not every elevated PSA level means danger, and not every prostate cancer requires treatment. For men over 65, the smartest choice is often to slow down, ask questions, and consider whether intervention will truly improve length and quality of life, or simply add new problems to an otherwise healthy life. Procedure 5. Routine colonoscopies. After 75 colonoscopies have long been considered one of the great success stories of preventive medicine. By detecting and removing precancerous polyps, they can dramatically reduce the risk of colorectal cancer, which is one of the leading causes of cancer-related deaths. For people in their 50s and 60s, the benefits are clear. Early detection saves lives. But once a person passes the age of 75, the equation begins to change. A colonoscopy is not a simple test. It requires sedation, a lengthy preparation process, and carries real risks: bowel perforation, bleeding, heart complications from anesthesia, and dehydration from the prep. For younger, healthier patients, those risks are acceptable when weighed against decades of potential life saved. But for seniors, especially those with other medical conditions or a shorter life expectancy, the math often no longer adds up. The U.S. Preventive Services Task Force now recommends stopping routine colonoscopy screenings at age 75 for most people. Why? Because the benefits take years to show. If a polyp is removed today, it might prevent cancer 10 or 15 years down the road. But for someone in their late 70s or 80s, the chances of them developing life-threatening colorectal cancer in that time frame are already quite small, while the risks of the procedure itself are immediate. Consider the story of Linda, an 80-year-old who had faithfully undergone colonoscopies every 10 years since turning 50. At her doctor's urging, she scheduled yet another one. The prep left her weak and dehydrated, and after the procedure, she experienced internal bleeding that required a hospital stay. In the end, no dangerous polyps were found, and the procedure did more harm than good. For Linda, the risks outweighed any possible benefits, a lesson she wished she had understood beforehand. So why do so many older adults continue to receive routine colonoscopies? Partly it's inertia. Patients who have been screened regularly for decades feel uneasy stopping. Doctors, too, often err on the side of just in case, fearing what might happen if something is missed. And as with many procedures, financial incentives can keep the practice going even when guidelines suggest otherwise. That doesn't mean older adults should ignore digestive health. If new symptoms arise, such as unexplained bleeding, sudden changes in bowel habits, or persistent abdominal pain, Diagnostic colonoscopies are still important and appropriate at any age. The key difference is that routine screening for otherwise healthy seniors is often unnecessary and potentially harmful. For many people over 75, safer alternatives exist. Stool-based tests like the FIT or stool DNA test can detect warning signs of colon cancer without the risks of sedation or invasive procedures. And for those in good health who feel strongly about continued screening, these non-invasive methods provide peace of mind without the burden of a full colonoscopy. The key lesson is this: screening should always be balanced against life expectancy, overall health, and quality of life. For seniors, avoiding unnecessary colonoscopies doesn't mean neglecting health. It means focusing on what truly matters for the years ahead. Smarter care, not just more care. Reaching 65 and beyond is a milestone worth celebrating. It's a stage of life that should be filled with freedom, joy, and a focus on living well, not endless cycles of medical tests and procedures. But too often, our healthcare system sells the idea that more intervention always means better protection. The truth, as we've seen, is more complicated. Full body scans, joint replacement surgeries for mild pain, aggressive heart procedures, spinal fusions, and routine colonoscopies past a certain age may seem like the responsible thing to do. But for many seniors, these procedures carry more risk than reward. They can lead to complications, emotional stress, financial strain, and, most importantly, lost quality of life. Sometimes, in trying too hard to prevent every possible illness, we end up creating more problems than we solve. That doesn't mean ignoring medical advice or rejecting treatment altogether. What it means is practicing smarter care. Instead of saying yes to every test or surgery, seniors should work with their doctors to ask the right questions. What are the real benefits of this procedure at my age? What are the risks, both immediate and long term? Are there safer, less invasive alternatives? And most importantly, will this procedure actually improve my quality of life? Good medicine is not about doing the most. It's about doing what matters most. For many older adults, that means prioritizing proven preventive care like blood pressure checks, diabetes management, vaccinations, and lifestyle habits over invasive procedures that may not change the outcome. At the end of the day, healthcare should give seniors more control, more peace of mind, and more healthy years, not take them away. So if you're over 65, remember this: protecting your health doesn't always mean adding more. It often means choosing wisely, focusing on what truly matters, and embracing a future built on both knowledge and balance.